Hello everyone, I am Vaishnavi Balasaheb Gore. I am discuss about skeletal muscle relaxant, peripherally acting muscle relaxant and action on different organs. Let's discuss about skeletal muscle relaxant definition. Skeletal muscle relaxant are drugs that act peripherally at neuromuscular junction or directly on skeletal muscle and cause paralysis or reduce muscle tone. Uses skeletal muscle relaxant are used primarily in general anesthesia to provide muscle relaxant for surgery. Peripherally acting muscle relaxant are divided into two types: neuromuscular blocking agent and directly acting agent. Directly acting agent include dandrolene, sodium, and quinine. And neuromuscular blocking agent further divided into two types: non-depolarizing, which is also called as competitive blocker, and depolarizing blocker, which include succinylcholine, suxamethonium, or decamethonium, and non-depolarizing blocker, which depending upon the action, which is long acting, intermediate acting, and short acting. Long acting include tuberculonin, pancuronium, doxacuronium, pipacuronium, and intermediate acting include vecuronium, atracuronium, cisatracurium, rivocuronium, ripacuronium, and shortest acting include mivacuronium. Neuromuscular blocking agent are up to type: depolarizing and non-depolarizing. Main site of action of these drugs are skeletal end plate of the skeletal muscle fiber. Directly acting muscle relaxant: first, dandrolene. Dandrolene block the ryanodine receptor. This receptor help in release of calcium from sarcoplasmic reticulum. Normally, 99% of the calcium which is present inside the sarcoplasmic reticulum, only 1% calcium which is present outside the cytoplasm. When nerve impulses come, 1% calcium enter inside the cell, and this 1% calcium goes to the ryanodine receptor present on sarcoplasmic reticulum and cause release of 99% calcium. This 99% calcium help in the muscle contraction. Now, due to the blockage of ryanodine receptor by the dandrolene, calcium 99% calcium is not released, so muscle not get contract, lead to the relaxation of muscle. This is mainly used for malignant hypothermia and neuroleptic malignant syndrome. Generally, dandrolene is not used because of it has hepatotoxic nature. Depolarizing blocker: succinylcholine. Succinylcholine stimulate more than required, lead to the prolonged depolarization, lead to the flaccid paralysis. But succinylcholine have a partial agonist at NM receptor, so it initially cause fasciculation. After some time, muscle get relaxed. Due to this fasciculation, post-operative muscle pain occur. Succinylcholine is shortest acting muscle relaxant because it is metabolized by pseudocholinesterase. Generally, this succinylcholine have a short action. It is mainly 3 to 8 minutes. Transient apnea occur seen at the peak level. In people with a liver disease or atypical pseudocholinesterase due to the genetic defect, metabolism of succinylcholine is slow, result in a several neuromuscular blockage leading to the respiratory paralysis with the prolonged apnea. Non-depolarizing or competitive blocker. Mechanism of action. Acetylcholine is the agonist at the NM receptor, where DTCA is antagonist at NM receptor. So blockage of this NM receptor by the DTCA lead to the no site for the binding of acetylcholine to the NM receptor, lead to the muscle relaxation. Competitive blocker produce flaccid paralysis. The order of muscle affected are firstly eye muscle, then neck, face, hand, feet, limb, trunk, and finally respiratory muscle are relaxed. But the recovery occur in a reverse order. Firstly, respiratory muscle are recovered, so the apnea is not occur. Tuberculosis or DTCA cause release of histamine, so lead to the bronchospasm, which aggravate the asthma, and due to the vasodilation action lead to the decrease in blood pressure. So these are generally not prescribed to the patient which have a history of asthma or the history of hypertension. Let's discuss some MCQ. Which of the following drug cause transient apnea? First option pancuronium, second option botulinum toxin A, third option succinylcholine, last option mivacurinium. The answer of this question is succinylcholine. Second MCQ, dantrolene is first option centrally acting, second option directly act on skeletal muscle, third option depolarizing blocker, fourth option non-depolarizing. Dantrolene is mainly centrally acting drug. Post-operative muscle pain occur due to succinylcholine, doxacuum, dantrolene, vecuronium. Previously, I am telling about the post-operative muscle pain occur due to the succinylcholine, which have a partially NM receptor agonist. That's why this post-operative muscle pain occur after skeletal muscle relaxant dose. Which drug is used to reverse the effect of competitive blocker? Competitive blocker mainly bind to the NM receptor. So the anticholinesterase, it is the drug of choice to reverse the competitive blocker. Shortest acting muscle relaxant succinylcholine, second option rocuronium, third option mivacurium, last option acetylcholine. The shortest acting muscle relaxant are succinylcholine, which have mainly 3 to 8 minutes. Thank you.